most famous physical therapist on the internet.
Hi, folks. I'm Bob Shrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So this is the #1 stretch and exercise program for neck pain, for a pinched nerve, and so on. This was based on the book by Robin Mckenzie, Treat Your Own Neck. This is only, what, 10, 12 bucks, Brad?
Right, it's right around in there. And Mckenzie writes it for the layperson or the patient versus, the clinician.
Right, they're for the everyday person.
Right, and
so,
Mackenzie's been around for, he's passed now, but
right.
his system has been around. It's worldwide. It's been around for, 40 years?
Yeah, so we're going to show you the basics of it in this video, but there's a lot more in this book. So
sure.
I wouldn't, if you like what we're doing here, I would recommend you get the book.
Get a little more details.
All right, so let's start off with, it's kind of a progression of exercises here. You start off with a chin tuck, which you always do, the chin tuck, no matter what exercise you're doing. But eventually you may find one of these that works best for you, and that's the one you stick with. And what we're going to recommend with all these is you do it for like 10 repetitions, but you do it like up to 6 to 8 times a day. And that's the key here. You don't just do the exercise once and say, I'm done.
But there's some rules you have to follow in order to get that results.
Yeah, maybe you want to mention that right now, Brad. The pain, what the pain should be doing.
Right. Now, this all depends. If you've got neck pain that refers into the shoulder blade is common or down into the arm, you want to focus on those symptoms. If you just have neck pain back here, either way, things have to improve. By the time you do your first chin tuck, maybe not the first couple, but by the time you get to 4 or 5, you should start having some progress. In other words, the symptoms in the arm or the shoulder are getting less, or if it's just in the neck, the neck is starting to get less, and you can go a little farther. That's the green light. That means continue to do it that 6 to 8 times per day. If you do it and it just hurts like crazy and it's just irritating things, then
we're going to have to show you an alternative way to do it. Because if it makes things worse, you're definitely going to stop and adjust.
Yeah.
If it makes it better or if it stays the same, you can keep working on it.
And are we going to mention our series here? This might be a good time.
Sure.
If you do these, what we suggest, and none of them seem to work, you can go to our website.
Yeah.
Go ahead. You're good at
Go to the program section, and under the program section, you'll find one on neck pain. And we've got a whole series of videos. You can look for videos that'll tell you what to do if this didn't work.
Right. There's other options, other stretches and range of motions, and you just look through the videos, look at the title. If the title fits what your needs are, click on that. Usually around 10 minutes. They also come with a PDF printout, which has a preview or a review of the whole video, as well as the exercises, so you don't have to go back and look. It's a wonderful deal.
Thanks, Brad. Why don't you show a chin tuck in the chair, Brad?
There we go.
And then I'll show it on the mat.
First thing, this chin tuck we're talking about, we've have mentioned this before
a
a few videos.
1,000 times.
You have to put yourself in good position. Don't use a soft, cushy recliner chair. Get a firm chair. It's nice to have armrests and a firm, upright backrest. Get your bottom back in there. It's critical this is done. Good posture, and your head's going to be like this. Is probably why you got the neck pain in the beginning, maybe poor posture over time. And then we're going to go back and tuck the chin. I tell my patients, bring your chin in towards your throat, but don't go back like this or down like this. It's straight back like someone's taking a pie. You're going to put it in your face, and you're going to, back up. So you might do that, and I've had patients where, it hurts to do that. So you go gently into the pain, but don't push it, don't aggravate it. And after like 3 or 4 repetitions, you may find, it's starting to improve a little bit. Then you got the green light to go further up to 10 reps. After you're done, if it feels better, then you do it, every hour or 2.
Yep, and even with that, if it starts feeling better or you're doing okay, you can actually do a little overpressure.
Exactly.
You can actually take your fingers and push on your chin, or you can take the web of your thumb and push back like that too.
And don't get too aggressive with it.
Yeah.
That doesn't mean, if a little push is good, a lot more is better. You need to be progressive and gentle.
Now, to be honest, I haven't used this much, Brad, but sometimes people, if they have trouble with the chin tuck,
Yep.
you could take a rolled towel like this
Yep.
and have them lie down and actually work on chin tucks like
Yep.
this. It's just for some people who seem to have trouble with the concept, they seem like they do a little bit better on this.
And sometimes just laying down and taking the weight. I've had people do it without the towel roll, just lying
Sure.
flat. So you can experiment with that. Either way, you might find you can't do it seated, but laying down, all of a sudden you can do it, and then you progress to the seated position.
So it's a good warm-up exercise, and it's a good repositioning exercise that you can do throughout the day to make sure that you don't have that forward head, that
Yeah.
you're putting the head back. All right, once that is okay, you're going to actually go to the first mainstay exercise, I would say, Brad.
Sure.
You're going to do the chin tuck. Yeah, you're going to have a good solid back. You're going to lean up against that, and you do the chin tuck, and then you're going to work on extension. Now, this is like the key exercise of probably all the ones we're going to show you on this video.
So extension means looking up towards the ceiling.
Now, what you're going to find, and Brad and I have seen lots of patients with this, is a lot of them just can't do it. Like it hurts.
Yeah. Oh, it hurts, and sometimes under the shoulder blade makes the pain in the arm
Yep.
worse.
And if you're one of the lucky ones that can start working it right away,
Yep.
just keep working on that. And you want to go further and further and further. You want to go as far back as you possibly can. I remember when I took the course, Brad, they were working on me, and I couldn't believe how far back they could get me. I mean,
Yeah.
so you want to go back further and further. As long as pain's not getting worse down the
Yep.
arm, it's maybe even getting better down the arm.
Right.
And-
And overall, you know, if you do it repetition, because we're not going to go back there and hang out for 20 seconds.
Right.
You're just going to go back and come back up. It should feel better as you do more of them. If it gets worse and worse and worse, then we've got some other options. we'll
Yeah,
talk
and that's
about.
where you're going to start using a towel. And most of our patients need to require a towel.
I almost always,
Yeah,
unless I have good results, but the towel's a nice way to progress.
Yeah, I go pretty quickly to the towel.
Yeah.
And-
So you can roll it up like this, or do you want to show the self?
You show theirs first, Brad.
I'll start, especially if someone's got pretty good neck pain. I'll have a thicker towel. It's more comfortable. Put the towel typically low on the neck, and
But you can experiment.
Yep.
You can go up and down.
yep, you can put your hands here. I'll show you this. And oftentimes people say, "Oh, that feels better. I can go back farther. It doesn't hurt near as much." Sometimes we'll have them go up with their hands. Do it this way.
Yeah.
And that little pressure up puts a little traction along with that range of motion.
He's
and
blocking his mic.
yeah.
Yeah.
Yeah. So anyways, you could try either way, work with it, and you know it's good if it feels better and you get better range of motion.
So you also can take a towel and use the selvage, which is the woven part of the
Yeah.
woven end of the towel.
I just call it the edge.
Yeah. And, Brad and I actually have discovered that a belt works really well, too.
Yes.
It
Yeah.
actually maybe would work even better than this.
Yep.
So you're going to use this, and the advantage of the selvage is that you can hit a specific level of the
Sure.
neck. So, like, let's say you're finding out that the lower up part didn't work. I'm going to hit my mic. Aren't I?
Yep.
So I can hit, there, I'll get it, yeah, Brad. Right there. I can go right onto a specific level. I like to keep it slanted up a little bit,
Yeah.
the towel, because that's the way the bones are shaped. And then you can do the same thing. You can go up, and again, you can hit different levels and see which one works the best for you.
Now, if you have arm pain associated with the neck, it's probably a pinched nerve, and sometimes that painful arm, when you go up, it's
Yeah.
not comfortable. So this is a little difficult, but you can do it. Take your good hand, leave this one down, and work it.
Oh,
that
thanks for
way.
remembering that, Brad. I
Yeah,
forgot
yeah.
to include that. So, all right, that's why we work together, Brad.
Yeah.
All right, next one. You're gonna eventually try to work away from the towel, and then you're gonna do extensions. And when you do extensions, if you start getting way back, you can finally work on this. You go back and you just wiggle your nose like an inch to each side,
Yep.
and you try to go back further while you're wiggling.
Yeah.
So that it's kind of a self-mobilization. All
Yeah.
would you say?
Yeah, and
Yeah.
I don't know if we have this on here, but just you could just support with your
Yeah.
hands too, And I'll
Good
just tell
point.
people, shake your head no, just not
Yeah,
a big no,
yeah,
but just
just
a
a-
little no.
And while you're doing it, you try to go back further.
Yep.
And so again, the idea is the magic happens when you get the neck way back, and by then you're starting to hope that the pain has completely come out of your
Right.
arm.
You'll notice this if your range of motion improves going back. Almost all the time the symptoms are centralized. You're
Yeah.
going up out of the arm, going more towards the center of the neck, and everything overall is getting better.
Yeah, many of my patients I saw they'd start off and they'd have this much movement.
Yep.
And then,
Yep.
by the end they're getting full movement. If it's not working at all, the one thing we want you to try is you're still going to do the chin tuck, but let's say the pain's on this side. You're going to do the chin tuck, and then you're going to actually side bend, try to put that ear on the shoulder. Yeah, Brad's going to show the
Here.
angle.
So the pain's here. We're not going to look down there. I mean, you could try that, but we're going to initially start by
Yep.
tilting this way and then monitor. Does the pain or the numbness get worse in the arm or the shoulder blade or not? And you might have to bump into it a few times
Yep.
and see how it responds. And after repetitions, 3 or 4 repetitions, if it clearly is getting better in your arm, then you're going to work that some more.
Yep, and you do this exercise instead of the other one if this is
Right.
the one that works. You figure out which one works. This one is the one that works for me.
Yep.
And I just recently had a dentist too that it
Oh,
just
yeah.
like magic with him. I mean, it was like he thought I was his savior because I mean he was having pain all. I mean he couldn't work.
Sure.
I mean that's
right.
so I think he found out too when he worked on people he had his neck one way.
Yeah, for
And-
years he's
yeah,
probably
for
had this
years and years.
unbalanced posture, and it came back to haunt him.
And me the same thing. I write my notes a
Sure.
certain way, and
Yeah.
that's why I got to do a chin tuck and go the opposite way
Yeah.
every so often. All right, check it out, and good luck with it.